Well, good evening once again. Thank you for joining us on this Monday. We are taking an in-depth look tonight at the state of mental health care here at home and beyond.
Yeah, the profession is running into a problem that is likely to get worse. The number of people looking for help is increasing and outpacing the number of new providers who enter the workforce each and every year. Nearly 1 in 4 adults say they have an unmet need for mental health treatment. That's a number that has not gone down since 2011. Here in New York State, more than 50% of people have a mental illness but do not receive treatment. By 2025, the mental health workforce anticipates shortages for psychiatrists, psychologists, and social workers. But the problem may not just come down to the numbers. The options for mental health professionals may not match the diversity of the patient pool. In fact, just 2% of psychiatrists and 4% of psychologists in the U.S. are black. 7 News anchor reporter Taylor Epps breaking down what this means for our communities moving forward.
Yeah, Jeff, it's such a big problem. We are in a situation now where people actually are asking for help, whether that's calling the new 988 number or reaching out for one-on-one help. The need for mental health care is on the rise, but it's growing faster than the number of people who can help.
I see, people coming out of school, opening in their practices, but still, once we open, we're booked.
More doors are opening for anyone needing mental health help, a need the pandemic really highlighted in our community.
There's always going to be a need.
But those doors aren't opening fast enough. According to Mental Health America, the number of mental health providers has gone up in almost every state, but the need for mental health care is growing faster.
It's so busy, and it's not just here in Buffalo, it's everywhere.
Erin M. Moss has been a mental health therapist in Western New York for 15 years. She tells me it's an even tougher issue for people of color. She says about 90% of her patients are black, and when she's booked, people of color don't have many other options.
It's hard to find someone that you can relate to. Once you get the courage to say, I want to come in, I want help, but then how do I find someone that knows what I've been through?
Patients trust you more if they see a face that looks similar to you.
It's something Dr. James Thompson sees every day working with psychiatric patients at ECMC.
There aren't enough faces that look like mine in psychiatry or medicine at large.
According to the American Psychological Association, about 86% of the psychology workforce is white, 5% Hispanic, 5% Asian, and 4% black. And the Department of Health and Human Services predicts we'll see a shortage of psychologists and mental health professionals of all races by 2025.
How do we fix that?
We need to compensate therapists, we need to celebrate therapists, we need to encourage them to go into this type of field.
Mental health has always been woefully underfunded, and that translates into lower wages, longer hours, large caseloads.
Jane McGavro tells me the Patrick Lee Foundation is trying to lighten the load for our mental health professionals, providing 25 scholarships to graduate students to get them over the finish line.
And remove those financial constraints, knowing that they're going into a career that will probably pay lower wages than some other professions.
It's money that helped Dr. Thompson finish at UB's Jacobs School of Medicine. The overall goal here is to help bring more people, especially those who look like him, into the field and keep them here in Western New York.
It has to start early. It has to start with early childhood education. People need to be able to see themselves in the doctors in the community.
So while the work continues to get more mental health professionals, those working now say don't wait to seek help. You may not get that appointment right away, but there are steps you can take, numbers you can call, and resources you can use, and we have them for you on our website at WKBW.com. Leah?
All right, important resources. Thank you so much for that.